Hi everyone, this is Kirby Alparawanda from BSN First Year Section E, and I am from North Valley College Foundation Incorporated. Now I am going to perform the skin assessment. So skin assessment captures the patient's general physical condition based on careful inspection and palpation of the skin and also documentation of your findings. So the first thing we need to do is to review the previous medical records of our client. So it is important to review the previous medical records of our client to identify the errors through claim analysis and or medical record activities. Okay, so we have also here the paraphernalia which we can use from to our assessment. So the first we have gloves to protect ourselves from the cross contamination between our patient, the alcohol for our hand hygiene, and the pen and notebook for us to note the subjective data and also the objective data. And before doing anything, we should prepare or perform the hand hygiene or hand washing to prevent the spread of microorganisms. So now I am using the alcohol for us to do the um, hand hygiene. So after using this, we can now proceed to another procedure. So please come in. Okay, good morning, sir. Please be seated.
Good morning.
And before anything else, I would like to introduce myself first. My name is Carbial Paraonda, and I am your student nurse for today. And you are?
Russell Stanley Sandoval.
And how you would like me to call you?
Call me Russell.
Okay, Russell, before anything else, I would like to verify some of your personal information. Would that be alright with you?
Yes.
Okay, so you are Russell Stanley G. Sandoval, right?
Yes.
Your age,
19,
your birthday.
June 26, 2000.
Okay, so it is important to verify our client's identity in order for us to ensure that we are in correct patient, and we should call them what they want to be called. And today, Russell, we are going to perform the skin assessment, including your hair and nail. So why do we need to do this? In order for us to ensure that everything is normal, and if there is anything abnormalities in your skin, like skin discoloration or in skin lesion, we need to take note of that so that we can prevent any further complication. Okay,
Okay.
so it is important to explain the procedure in our client so that he can understand and also to be aware of what is going on. So do you have any question before we proceed or clarification?
No.
If you have, then you can raise your concerns freely. Okay,
Okay.
so it is important to ask or give the opportunity to ask our clients question before we proceed in order to ensure that the patient understand everything and also to avoid misunderstanding. Okay, so now after that, we need to provide the privacy to our client, just simply closing the door and closing the window and also adjust the room temperature. And also, in doing this, we should always ask our client complaints. Do you have any current complaints about your skin right now,
No.
like discoloration or increased pigmentation or even lost pigmentation?
So far, no.
Or you have a problem in using lotion or any medication that can cause irritation or affect your skin integrity?
No.
Okay, so that's good. So it is important to know our clients' current complaints in order for us to identify the problematic areas and also to solve the problem. Okay, so now, in assessing the skin, we need to inspect and palpate the skin and also note their color, moisture, temperature, texture, and mobility and trigger, and also the skin lesion. So the first thing we need to do is to inspect the overall coloration of the client's skin. So is it okay for you to touch your face, to touch your skin, or any parts of your body?
Yes.
Okay, so it is important to ask permission first before we are going to do the assessment, because in order for them to be comfortable. Okay, so may I invite you to raise your hand, please? Okay, so what we are trying to look here is any signs of color, any signs of cyanosis, any signs of jaundice, because that indicates the abnormalities in the skin. But as I'm inspecting, I don't see any problem on it because the color of the skin ranges from light to deep brown, which is normal. and it doesn't have any other also. Okay, so that's good. Now we can now proceed in checking the integrity of the skin. So in doing that, we need to pay a special attention to pressure point areas. And if you notice any ulcer or any signs of ulcer, you need to use the Braden scale. So Braden scale is used for us to assess a patient's risk for developing for a pressure ulcer. And also it is composed of six subscales, which are the moisture, skin moisture, mobility, activity, friction, shears, and also nutritional status. So now I am now checking the skin integrity of my client. Okay, so as I am inspecting or assessing, I don't see any problem in it. So that's good. So now we can now proceed to palpate the moisture, palpate the skin to assess the moisture. So we need to remember that moisture in the skin folds and moisture in the axilla is normal, but any signs of excessive moisture and excessive dryness is already abnormal, so you need to take note of that. Okay, so we need to check the unexposed areas or the skin folds of our client to assess the texture of our client's skin. So as I am assessing, I don't see any problem with it, and it is normal. So now we're going to proceed to assess this palpate the skin to assess the temperature. So in doing that, we need to use our back parts of our hand. So why do we need to use our back parts of our hand? Because this areas is more sensitive to temperature, so that we can easily feel the temperature of our client. So is it okay for you to touch your face or to touch your skin?
Yes.
Okay, so again and again, you need to ask permission first to our client so that he can be aware of what is going on. Okay, so what we are trying to feel here is any signs of color, any signs of fever, any signs of inflammation or infection like inflammation. So as I'm inspecting, I don't see any problem in it because my client has a normal temperature, so that's good. And reminder everyone that if we're going to assess the skin areas which are open, we need to don our gloves or to wear our gloves. Okay, so let's proceed to palpate the skin to assess the skin turgor mobility, skin texture, mobility, and turgor. So now, in doing that, we need to expose the parts of the skin just below the clavicle. And in doing that, we need to pinch it using our palmar surface of our three middle finger and pinch it. And if you pinch it and it quickly returns, or it if you pinch it, then it immediately return to normal, then the skin is there is no signs of skin turgor. There is absence of skin turgor. But if the skin stays pinched, then that means there is a presence of um skin turgor, and that indicates dehydration, so you need to take note of that. So I am not checking the uh, below the clavicle of my client using the three middle fingers of our hand. Okay, as I am checking, there is no problem, it is normal. So now I'm going to assess the skin lesion. So skin lesion is very um, is very known to the skin. So may I invite you to raise your hand like this. So what we're trying to look here is any signs of bruises, any signs of wound of insect bites, any signs of scratches, because that indicates abnormalities in the skin. But as I am inspecting, I don't see any skin lesion, so that's good. And if there are, you need to take their size, their shape, and their color as well. Okay. So the next thing we need to do is to by the way, what is skin lesion? So skin lesion can be primary, like macula or papule. It can be secondary, like pressure ulcer or fissure. It can be vascular, like angioma. And also, in the worst case, it can be skin cancer. If you notice any skin cancer, you need to take note or evaluate it using the ABCDE patterns, which you note its asymmetry, its border, its color, its diameter, and its elevation or evolution. So after that, we can now proceed in palpating the skin to assess the edema. So in doing that, we need to apply pressure on the skin using our thumb. So may I invite you to raise your foot right here? Okay, so why did I ask him to raise his foot right here? Because these areas include the feet, the ankles, and the legs of my client. And the upper areas include the face, the hand, and the abdomen of the client. So, in assessing the edema, you should use the thumb of your finger. So, um, as I'm assessing the client's skin, this the skin is quickly return the color of the skin quickly return to normal, which means normal, and there is absence of, or there is no signs for edema. So, but if the skin is stay pinch, or it is does not quickly return to normal, then there is a presence of edema. So, okay. But as I'm assessing, there's no problem on it. Okay, thank you. So now we are going to perform or to check the hair, the scalp, and the skull of our client. So in doing that, we need to check the overall, the general condition, the general um, color of the hair, and also to check. We need to check the skull of our client. So in doing that, we need to wear our gloves. So why do we need to wear our gloves? In order for us to prevent the exposure, or to reduce the risk of exposure to bacteria, which can be transmitted by touch. So, okay, so wait for a minute. I'll just wear my gloves first. Okay, so another one. Okay, so wait for a minute. So in checking the hair of our client, we need to separate the hair from the scalp at 1 inch intervals to assess, and then palpate, and then inspect the hair cleanliness or dryness. So may I inspect your hair? So after this, if you see any lesion, you need to take note of that. Okay, so you need to separate 1 inch interval. You need to separate the hair from 1 inch interval from the skull. So as I am assessing or inspecting the client's hair and the skull, there is no problem on it, because there is no dryness, there is no oiliness. I say is the cleanliness of the hair of my client, and healthy hair, as you can see. And then now we can now proceed to the distribution of the scalp of the client, or the body, the pubic hair of our client. And if you see any signs of unusual growth in the body, or in anywhere elsewhere in the body, you should take note of that. Okay. Okay. So your hair is very healthy. So that's good. Now this time we are going to check the nails of our client. We need to check its cleanliness and its grooming. So all we need to do is, can you raise your hand first, like this? So what we're trying to look here is any signs of clubbing, any signs of cyanosis, or any problem on it. So as I'm assessing my client's nails, as you can see, there is no problem. So that's good. And can you raise your foot right here again to check the two nails of yours? Okay, so that's good. There's no problem. And okay, a reminder, if you are going to check the skin, the nail of our client, we need to note its shape, its color, and its texture, and see if there is any clubbing or any problem on it, and you need to take note of that. But as I'm assessing, there's no problem in it. And beware, and or always put in your mind that if you are going to check our the check if we are going to check the skin of our client, we need to see if the nail plate is attached to the nail bed of our client. Okay, as I can see, and as I am assessing this the nail of our client and the toenail, there is no problem at all, so that's good. Okay, thank you, sir. Okay, now let's proceed to check the capillary refill of our client, I mean. So, can you raise your hand like this? So, what you are trying to do here is to press the or palpate the press the nail of our client. So, as I am pressing, the color quickly returns to normal. So that means the nail has fast refill, and that's normal and that's good. So if the skin is does not quickly return to normal, then it has a slow refill, and that slow refill indicates indicates the respiratory or cardiovascular disease that can be eventually that may eventually lead to hypoxia. Okay, so as I am assessing, my client is very perfect, have a perfect nails, clean nails, and there's no problem at all. Okay, so we're done in assessing the nails. So all I have to do is to summarize all of those gathered information from you and also discuss it to you. Okay.
Okay.
Okay, so now where you don't have any problem in using lotion or any medication, your skin is healthy, your hair is healthy, you don't have any lesion or any pigmentation, you don't have discoloration in your skin, you don't have problem in your nails, you have a clean nails, the nails are attached, the nail plate attached to the bed, which is good. There is no lice, and I think that's very good. So all you need to do is to maintain that healthy skin, healthy hair, and healthy body. And if you see or if you feel any abnormalities or any signs of any abnormalities, you need to see for the other healthcare provider. So I don't think that you don't have any problem in using anything. So now, Russell, before we end this assessment, do you have any clarification or question before we end this assessment?
No.
Okay, so that's good. So I am so grateful and thankful to do this with you, and I am so I'm so very thank you for your effort and time, also your cooperation during this assessment. So nice to meet you, and goodbye.
Okay, thank you.
Thank you. And so after that, we can now proceed in performing after the all assessment. We can now proceed to perform the hand hygiene again to prevent the spread of microorganism and to reduce the risk of exposure to bacteria. Okay, I am now using the alcohol for our hand hygiene. And after that, we can now document the gathered information, all of our findings. Now, we can now note the abnormalities, but as I'm assessing, I don't have any problem on my client's skin, nails, and hair. So that's good. So thank you everyone for watching. Thank you for your listening, and I hope you understand and have a great day. Thank you.